Great. Thanks everybody for joining us. We have an amazing webinar today. Apologies for the delay. That was my computer and I having challenges, but we're so excited. This is the fourth webinar in our series with CACNA1A on different forms of therapy for our kids who have DEEs, or developmental and epileptic encephalopathies, these rare epilepsies. And we're so thrilled to have you joining us today. I am going to be very brief and just say that all of our participants are muted and you're off camera, so don't worry. But as we're going through today, I saw Kyle said hi from, let's see, Kyle from Texas, awesome. Oh, Kyle, Texas, that's Teresa joining from Kyle, Texas. I thought it was somebody named Kyle. Hi, Teresa. Teresa is our PT extraordinaire who did our first 3 in this series. If you haven't watched them yet, I'm going to drop them into the chat in a minute for you to check out later. But feel free to introduce yourself in the chat. And as we're going through, if you have questions, go ahead and drop them in the chat or the Q&A. And unless they're really clarifying questions about what's happening right then, I think, Amanda, are you cool if we do questions at the end?
Yes. Really, however, I kind of, Teresa knows this, I'm more like fly by the seat of my pants.
Yeah, clearly that's what we
I have, I have a small plan, and if we divert from the plan, that's okay.
Yeah, okay, very flexible, that's great. And hey, Gail, thanks for joining us from Canada today. So I'm gonna pass it on now to Lisa, who's gonna introduce Amanda to us, and then Amanda's gonna jump in and share all of her brilliant knowledge.
Okay, well, I am really looking forward to this. So thank you, Amanda, and everybody. So Amanda Luddeke, I hope I pronounced that right, Luddeke, is a speech and language pathologist who has practiced in pediatrics for the past 20 plus years in a variety of settings, from schools to early childhood. She now owns a private outpatient pediatric rehabilitation clinic in Victoria, Texas, and works as the lead speech pathologist there. Among her many passions are working with children with complex communication needs. When she's not at the clinic, she is a wife and a mother to 3 amazing children. So we are really excited to have you, Amanda. Amanda is good friends with Teresa, correct? And so that's the connection. And so you really
He treated my son, who was premature and was having trouble moving, and by all accounts, and he is typically developing now and doesn't look like the preemie that he was born as. And but then Teresa was also great friends with my supervisor, and she swayed me over to ECI for a while. So a little bit about my very quick background is that I have worn lots of hats. I was in the school districts for more than 10 years. So I have played in that arena for quite some time. And I was primarily with what was at that point in time called the severe and profound low incidence population. And now we know those children to be more with children with complex communication needs. And then I went to ECI for a few years and loved that, but didn't feel like I was making the difference I wanted to make, and I couldn't follow the kids long term. So God has allowed me to now own my own clinic, and we do PT, OT, and speech here, along with some ABA, and we treat close to 200 kids a week. So I will start by saying that the children have taught me a whole lot. I don't know that I learned as much in my book knowledge as I've learned from the kids. I am not a purist in any shape or form. And most of what I'm going to share with you today is 20 years of kids teaching me. So this may not be what your speech therapist tells you to do. This is what has worked for me. And I don't spend a whole lot of time in outside research. I just kind of go with what really works. So that's what I'm going to share with you today. Please feel free to ask me questions. And I hope obviously I'm very long-winded, but I will try to keep it short and to the point. And I hope that we'll end with some demonstration today and that my camera and technology is going to work for you.
So I just wanted to say one thing, Amanda. So Gabi and I will keep track of all of the questions so that when you're done speaking, we can go ahead and present them. So anybody, please put your questions in the chat. Thank you.
Okay. I'm still trying to figure out. Apparently, am I sharing my screen? Can you see my screen?
Yes, it's beautiful. I see it.
Okay. All right. Do you actually just see, you see all my slides on the side, or do you just see?
It's not in presentation mode quite yet.
I don't know why. There. Okay. Apparently I didn't click the button the right way. Technology. That's what I will tell you. For the most part, technology will just do me in. So let's try. Okay. You kind of got my overview. What I will say is that all the materials that I'm going to use today, just front up disclaimers, these are things I use. I get no kickback from these people, no monetary compensation. This is just things that have worked. And I'm a firm believer in, if it isn't broke, don't fix it. Don't reinvent the wheel. Work smarter, not harder, because we're already working with kids that are struggling in lots of arenas. So this is what has worked for me. It may not work for you, but it's, so what the materials that I'm using, this is my guiding practice. Okay. So some considerations, right? Children with complex communication needs. What I can tell you is you can open a book if you'd like. It won't tell you about your kid. There's a great medical world out there, and it gives us lots of diagnoses and lots of things. And for every one child that comes with me with a diagnosis, another kid will prove that thought process is wrong. But when I am considering a kid who is struggling in the communication department, I always have to consider the comorbid diagnoses. And for every diagnosis that I add, it adds a new piece to that puzzle, right? So in addition to having a communication deficit, it's why you're coming to see me. If you tell me the child has seizures or cerebral palsy or visual impairments or hearing impairments, or they have a lung, heart, or a kidney condition that affects their arousal state, those are all things that I have to consider as I put the pieces together for you and help us try to decide what's going to be next, right? And then on top of that, we're going to add some medications. And so I say that because it's going to matter. It's going to matter when your child is alert and awake. It's going to matter when their feeding schedule is. All these things are going to play into when your child is going to be the most ready to communicate. And those are the opportunities that we're looking for. And I need you on my team to tell me, yeah, but at this time during our day, it just doesn't work. Like there's not anything that we can do. They're going to sleep for the next 4 hours. Well, that's not when we want to plan therapy. We want to plan therapy and we want to plan intervention when the child is alert and awake and at their optimum. So those are things that I'm just considering with you walking in my door. Okay. These kids can be evaluated. It doesn't look like every other evaluation, but we should take some time, and these are things that we're going to consider. Most of these don't participate in a standardized assessment, but just because a child is nonverbal or minimally verbal does not mean the child isn't communicating. And it also does not mean that the child isn't capable of learning. That I can tell you. All behavior is communicative, and I want you to adopt that as your new definition for communication. All that speech is, verbal speech, is a socially acceptable form that everyone has agreed upon. So that is communication. It is a behavior that has been shaped by people reinforcing for me that when I say these words, I get my needs, my wants and needs met. So I want you to reconsider, if you haven't, and that communication is nothing more than a behavior. And every behavior that your child is doing has the possibility of communicating something. So our goal is to determine the functions of those behaviors and then shape the behavior into something that's consistent and considered a more conventional mode of communication. So what I mean by conventional means nothing more than it's socially acceptable. So some conventional forms that we use a lot around here are sign, gesture, picture or object exchange, the use of a speech generating device, and verbal speech. But that is not to say that that's the only forms of conventional communication. I have some kids who communicate with me through yes, no, and eye blinks. It's a great starting point if I think that you have the cognition to do this. So I'm going to use whatever you have, and then I'm just going to shape it. And we're going to shape it with a lot of trial and error. And I know that doesn't sound super sophisticated, but that's pretty much how most of us learn anyway. We get it right, we get rewarded for being right, and we get it wrong, we get a negative consequence for being wrong, and then we adjust our behavior. This assessment should take into account all behaviors that a child exhibits, especially for the following areas: protesting, requesting, social exchanges, and acquiring information. I'm going to walk you through those levels and what we are looking at, and hopefully that'll kind of give you an idea of what we're looking for. Okay. Now, I'm going to be very blunt and honest because there's no need to sugarcoat this. There's a prerequisite for purposeful communication, and not every child born has that. The prerequisite to having purposeful communication is first knowing what it is. Okay. Purposeful communication is when a person sending a message understands that by what he or she is doing, he or she is in fact affecting their caregiver. Okay, so here's an example of that. That's not necessarily socially acceptable, but it is an example. I hand my child juice, they slap it out of my hand, and it falls on the floor. And I pick it back up and I hand it back, and they slap it out of my hand and it falls on the floor. I put the juice cup up and I walk away. The next time I go to hand the juice cup, if they don't want it, their immediate response is to slap at my cup. All right. They are well aware at that point that what they are communicating, the slap of the hand, indicates that they don't want that, and they are affecting what I'm doing. I've put it up. You don't want that. That's fine. Okay. So that's purposeful communication. Okay, so when a person is using a behavior to communicate, the first thing we want to determine is, does the person realize he or she is affecting his caregivers by the behaviors they're doing? Now, there are kids who don't have this, all right? They do something. It's not that they're not being communicative because we're supplying the meaning behind that. But they're over there beating on the door. They're not looking at us. They're not coming to get us, but eventually we walk over and open the door. They're not aware that they're affecting us. They're just standing at the door hoping it's going to happen. So see the difference between the two? And I know I'm kind of using moving kids and kids that have that motor ability. We're going to talk about those that don't, but these are just ways that I can kind of help you quickly understand this. Purposeful communication sets in between 6 and 8 months of age, and it gets more sophisticated the more the cognition and the development continue. Now, if you don't think your child has purposeful communication, that does not mean they don't, and it does not mean that you can't build it. Okay, so this is an assessment that I use. It's not a sophisticated assessment. It's called the communication matrix. I will at some point in the chat put a place where you can go and look it up. You can certainly Google it. It's a free assessment. It's an assessment that you can perform yourself on your child. It has these questions. You answer the questions and it gives you this lovely little map at the end. And actually, I have a picture of what the map looks like right here. And I'll swap over super fast. let me stop my share really. Okay, can you see this?
We can.
Okay, so this is a copy of what the matrix looks like before it's filled out. Like I said, it's on a website, and their goal is to help parents and educators plan for how to provide appropriate communication systems for children with complex communication needs. So as a parent, it is something that you can do. We're going to walk through this communication matrix and look at the different levels. But it does a great job, I feel like, of taking a child who does not have a verbal communication system, or is using sign consistently, or using a communication device consistently, to determine how to better shape this communication.
And thanks for sharing that, Amanda. We can put a link to that so people can get a closer look as well. We'll include that. Mhm.
Okay, and it's all online. It also allows you to print out the pieces. It does a great job of explaining. So I feel it was designed for both parents and educators. So I feel like it's a very friendly, easy to use assessment. It can be given to any child at any age. It looks at what a child is doing to communicate and whether or not they're being purposeful. It does consider that all behavior is communicative, and it takes into account whether your child is using their body, their face, if they blink. It takes into account all of those things. So I do appreciate it for having those great qualities. And honestly, I haven't seen anything else fairly close to it that's simple and at least gives us a picture. You know, we're just looking for a snapshot when we're getting started. All right, so let's talk about these behaviors and what they look like. All right, pre-intentional behaviors. This is what your baby's born with. This is 0 to 3 months. What you need to know about this state is it's mostly a state of protest. It's not a state of requesting. What a child is doing when they're born is crying. They're crying to protest how they're feeling. They're hungry. They don't like the feeling in their stomach. They cry. You're a great parent. You get up and you take care of your child's need, right? Those first 3 months, cries all kind of sound the same, whether you're wet, whether you're hungry, whether you're just wanting to be loved and hugged on, they're all the same, right? And it's about 3 months of age when we see them start to have variations in their cries, right? So this is that age. It's prior to using a different set of behaviors. It's mostly just crying. Birth to 3. All right. So this is what a child can do here. Pay attention to the words. This child can express discomfort. They're not really saying, it's not like a hard no, right? It's discomfort. They express comfort, right? When they're fine, they're happy, and we're hugging them and smiling them. You might see these little smileys, and they should be kind of looking at our face, expressing interest in others to some degree, right? This is kind of that stage where mom walks in the room and picks baby up and they just immediately quiet. All right, that's this stage. It's an expressive interest, it's an expressive comfort, and an expression of discomfort. All right, now we're going to move intentional behaviors. Okay, the child has control of their behaviors, but they're not communicating intentionally. Caregivers interpret these needs. We hear the baby cry. It's about the time they're supposed to eat. So we're interpreting that they're hungry. We start to walk into the room. We're talking to them. They quiet, right? They change that behavior based on hearing us. But they're not calling us. They're just still kind of protesting that state. Mom starts to fix the bottle, and maybe while they see the bottle come into their sight, they quiet. All right, so they're not really asking us to feed them. We're still applying meaning to the behavior. So that's what it looks like at 0 to 3. What it looks like when you're older is I'm beating on the door, wanting to go outside, but I'm not looking at you, and you apply meaning to, hey, you want to go outside. I've given that meaning. So I go over and I open the door, or I redirect you, right? Same for those motorically involved children, right? When they're kind of fussing and you walk in with something to change them with, and they see that, they quiet and they smile and they brighten. They know that you're there. So they're changing their behavior based on what you're doing, but they're not actually calling you. All right. So at this level, look how these words change. We are now protesting. We're actually physically protesting. We're like, nope, this is a no for me. I'm full. I'm hungry. I cry at that. The continuation of an action, right? I still want to go outside. I'm just going to stand at that door and bang on that. Obtain more of something, right? You finished your bottle. You're still hungry. You might reach, because you think about a 3 to 8 month old, right? They might reach up and grab that, kind of in that typical development. It's kind of looking at that too, and want more of something, or grab their bottle and put it back in your face. And they're attracting your attention, not purposefully, but the things they're doing are attention attracting. All right. Now we're moving into those fun stages. Unconventional communication, and notice underneath it says pre-symbolic. These behaviors are the child is communicating, and guess what? They know they're affecting you. What they're doing on purpose. So the difference, the child wants to go outside. He goes to the door. He stands at the door. He's beating on the door. He's like, dadgummit, mom's not coming. He goes and grabs her and he pulls her to the door and he puts her hand on the door. And she's like, nope, not paying attention. Puts her hand on the door again, right? He sticks with it. He's like, I know, you know what I want. Why are they called unconventional? Because they're behaviors that really past 6 to 12 months, we don't consider them socially acceptable. These are things more like really pulling and tugging, pushing. I call gross gesture indicating this, right? I'm not pointing. It's just this general vicinity. And the truth is, it's not a great effective form of communication, because then we play 20 questions, right? You want what? This? No. And then the kid falls on the floor. He's all upset because we didn't understand what he was really saying. And he doesn't do a great job of cleaning that up either. Hitting, biting, screaming, those behaviors, I kind of term those maladaptive behaviors. However, they serve a purpose and they're often easily reinforced. We just don't know that we're reinforcing them. You should put this in your head. You have the power to change these and shape these to reinforce behaviors as allowed forms of communication. You don't want them to hit and bite. Don't give it the attention. Replace it with something else that you give lots of attention for. The thing about it is, if one person is reinforcing that behavior, and so you'll be like, no, I don't reinforce them. I don't like when they do them. If I hand you something and you slap at it, and I say, hey, stop that, but I put it away, I reinforced it anyway. You got what you wanted. So how do you fix that, right? I hand you something, you slap at it, I take your hand, I say, all done. And then I put it away. And I don't say anything really about the hitting and the slapping, but I don't give you what you want for doing that. I'm replacing it with something else. But it really only takes one person in the whole group to keep that behavior alive. To put something on extinction, you truly have to put it on extinction. Okay, so here's now, what is this child doing? Okay, they're refusing or rejecting. They're requesting more actions, more objects, making choices, and new objects. You have to be at this level to be able to request and refuse and reject. And socially, you're requesting attention and showing affection. So this is a kid who comes in your space, hugs and kisses on you, even if it's just one person. We want to hear that. But they're pulling, they're pushing, they really, when they can't get it, they're going to do whatever it takes. That's the kid that we're talking about right here. All right, now we're going to move into conventional communication. All right, so same age, 6 to 12 months. Conventional communication is considered socially acceptable behavior. Okay, these are still pre-symbolic. So we're not really talking. We're not really signing. Although there is, they don't involve, this part doesn't involve a symbol. So it's not signing, but it is pointing, shaking your head, waving, blowing kisses, right? So bringing you something. So when I show you 2 items, you touch the item, you don't grab the item. So guess what though? If you don't have good visual skills or you're cortically visually impaired or blind, the likelihood of the person being able to use pointing as a form of communication is minimal. So I know that should be like, yeah, no joke, right? But not everybody knows that. And also, if you're motorically involved, it's very hard for you to kind of do these things, right? So like, if you don't have great head movement, guess what you can't do? You know how I shape this? A lot of times I shape it with eye blinks. If a child has some cognition at this level, while yes, no is a difficult skill to teach, you can shape it. And I'm going to show you some shaping of that. I have a quick video that I'm hoping to show. But 1 blink for no, 2 blinks for yes. I like them in that order on purpose. Or turn toward me if it's a yes, away from me if it's a no, or a tilt of the head. That's not a lot. But the reason why I like that, 1 is no and 2 is yes, is that when it's a yes, it's a definite, right? So, and I can shape that a little better. And I'm going to show you what that looks like here in a little bit. Okay. These guys, look how much more they're doing. Not only are they requesting new objects, they're now requesting absent objects, things that aren't in our environment, right? Because they're indicating. They are using greetings, directing our attention in polite social forums. They can shake their head yes or no, or eye blinks or something along that. And they're kind of asking questions. You're like, well, how do you ask a question if it's a pre-symbolic kid? Well, guess what? Right? So these kids can do that. They don't have to have a symbol. It's kind of just a gross gesture toward that. But these are things that they can do. All right. At the symbolic age, I'm going to wrap this all into one big deal. We're going to take a whole year chunk of time, but I hope I know this isn't like the bulk of what we're talking about today. Happens between 12 and 24 months typically. Concrete symbols are symbols in which a person uses an object or picture stimuli to represent an actual item. It's mostly what we call fringe vocabulary and mostly nouns. So really quickly, I'm going to show you this, what I'm talking about. Okay, so, sorry. That represents a ball, right? It's the real thing. It's a small one. So if a kid likes ball, this is a concrete symbol. Another concrete symbol is this baby doll. Sorry, it's glary. Sorry. Okay, so it's cut out like the doll. It looks like the doll that you have. It's an exact replica of the doll. This too is a concrete symbol. It's a picture of a toy, right? It's different form, a little more sophisticated, but it is still a concrete symbol. It represents the exact item that we're talking about. Same for something like this. Here is bed or sleep, right? This is just doll furniture. It's a replica of what I'm wanting to share with you. So a concrete symbol. As opposed to a core word or an abstract symbol. And that abstract symbol, it means that it doesn't actually represent what we're talking about. So an example would be, and maybe I don't really have one in front of me, mostly verbs. We call that core vocabulary, something I can't do, right? So how do you really show come? How do you really show go? Really, eat is a little bit abstract too, right? You can have a picture of a person eating, but you don't always, excuse me, that doesn't always show that information. So abstract symbols are words that are high frequency words most of the time, that core vocabulary. They are non-specific to situations. They're difficult to show. And guess what? All verbal speech is an abstract symbol. There's me saying apple. Sorry, me saying apple in no way makes a person who has no English exposure understand that that's apple. All verbal speech is abstract. All signs, for the most part, besides, no, really, all sign is abstract. All written word is abstract. Concrete are those exact pictures that you say, that's an apple. I know it's an apple. I can see this apple in the book, and it represents and looks like the object itself. Language is the combining of those two things together, your core and your fringe vocabulary. And you need more core than you will ever need fringe. And those are the hard pieces to teach. We always start with fringe. It's that piece that the kids know that they love, those high frequency words that are not high frequency words. They're those words that are situationally dependent: ball, cup, juice, cracker, right? Mostly nouns, like I said. That's where those kids start. But when you're already behind the 8 ball, you need to be working on core, those action and direction words, because those are the words that have the ability to direct me. If you say apple, I have no idea if you're wanting an apple, you saw an apple, you need an apple, you like apple. I don't know what you're talking about. But if you say eat and you point to an apple, I know what you meant. So we really want to be sure that we have the child being exposed to both core and fringe vocabulary. Okay, the long list that we had before with the pre-conventional communication, this adds to it. So all of the other stuff, plus now we can answer yes, no questions, ask questions, name people and things, and make comments. So 2-year-olds' language system can be fairly sophisticated. All right. Is there any quick questions about evaluation?
We did have one in the chat, which was,
okay,
to assess if a child has awareness of their impact, is that an issue of cognitive capacity? And if so, how do you assess that awareness in profoundly impaired children? Was a question Jayetta asked.
Okay, it can't. So the answer is, in just plain terms, yes. If a child isn't really aware that they're affecting you, then guess what? It's probably a sign that there's some lower cognition there. But I'm going to, I'd like to reserve the right to say, but maybe not. Where we're headed is incredibly motorically involved children. And guess what? The answer to that is, I've met some incredibly smart, motorically involved, visually impaired, hearing impaired children who blew me out of the water with what they were able to do and really what they actually had. So I've had kids come in and parents are like, no, I just think we're at the pre-intentional state. And we do a few things and we're not even in that ballpark. That's not even what's going on. But we have to be very systematic about how we tease that out. So, you know, if you give me just a few minutes, hopefully I can shed some light on that, because that's kind of where we're going, right? We've got this assessment. The assessment is a snapshot, but it kind of gives you an idea of what we're looking for, because the next piece that we're going to do is just this right here. Okay, here's some rules to live by. What makes this work is repeated exposure at the appropriate level. Okay, if you're pre-intentional, the goal is intentional. That's it. That's where you go. You don't go from pre-intentional to language. You go one step down. And the way that we figure that out is we keep assuming that you can be intentional, and we're going to keep layering it on. So for children with complex communication needs who must develop okay, if you have complex communication needs, and you don't have the capability for motor speech, the only thing left for you is an AAC system. I would love to tell you it's a magic wand that you wave. Nope. It's an incredible amount of hard work. It's tenacity. It's doing it every day as much as you can. It can be low tech. It can be high tech. And most of my kids are a combination of those things. But it does require consistent and repeated exposure in all environments. Everybody has to play. Those kids that are successful are those who stick with it even when it's hard. They're going to cry. It's going to happen. But we work through that. As a parent, my best advice to you is, if it's working, adopt it as part of your life. If a therapist says, I got X, and I can show you how to get X, I'd put X in my life, because it's going to be an everyday thing. There's no such thing as an AAC system at speech therapy or an AAC system at school. There has to be a system. It's their communication system. You have to know it. They have to know it. And I wish that was not necessarily the truth, but the truth is that's what we do with talking kids. You don't not talk to them at home. They only talk to them at school. So you do that for your typically developing kids too. If they're playing ball and that's something that they love, then you commit to extra practices and whatever it takes for them to be successful. So this is kind of that same thing, just we're working on communication. I also am a firm believer in, you can do it till you tell me you can't. I've won lots of kids over that way. I'm going to show you a little video here in a second of a guy. And maybe we'll just show it now, just because maybe that'll help you guys see what I'm talking about. And then the other thing is, I'll finish the slide out. Remember, what we're asking them to do is hard, and we have to have their buy-in. So if there's no buy-in, it's not going to happen. And it's not your buy-in, it's theirs. It has to be something that's motivating to them. And children always do better when we acknowledge that they're capable. And that's just true. Whether you think they understand or not, whether somebody's told you that, nope, they don't understand. I don't know. I've had lots of them that did understand far more than we ever thought they were capable of. And actually, let me show you that. I think I have to stop my share and get to my space. Hold on. Okay. Oh, here we go. Sorry, I lost that for a second. Okay. All right. Can y'all see this video?
Yes.
Yes. Okay. This is a video of a young man, stole my heart. He came to me with what we consider to be pre-intentional behaviors. This is about the 6th day of therapy. So I'm not talking to you about this is like a year from now. This was like his 6th day. He is cortically visually impaired. He does have seizures. He does not have, to my knowledge, any of the disorders that you guys possibly are working with right here through CACNA. However, cerebral palsy is obviously in his deal. He has a minimal volitional movement. We've been exploring fun activities. I have him set up with a switch. He has a minimal movement. You're going to watch me help him move. You're going to watch me play through some things. We won't play all 6 minutes, but I want you to see what we did. And this is what I'm talking about. And maybe this will lead to your question about cognition, because his mom was very truthful with me about what she thought he could do and what she thought he understood. And where we were was he cries and he smiles mostly when we enter the room. Okay. He is about right at 3.
We can't hear the sound, but we're seeing.
Okay, hold on. Let me see. Hold on. Let me try something.
Okay, can you hear me?
Yeah.
Okay, so let me see now if I play because I had it plugged into my video.
Yeah.
Can you hear now?
Yes. Can you make it a little louder?
Okay, hold on a second. If not, I will try to. Maybe I can just, like do closed captioning for you. Okay, so I have taken his hand and felt the ball, right? So the goal is that if we were going to put together a symbol system of some sort, he would in fact have some idea of what things felt like. So we're going to immerse him into everything that we can think of. We're going to feel, smell, touch, move, whatever it takes. So I've felt it, and now I'm asking him, do you want this? And my question was yes or no. Now we've established through a few sessions of 1 blink for no and 2 blinks for yes. That is his movement pattern. His head is tilted back. If I'm tilting forward even more, he'll fall forward. So I'm playing with gravity. I got the caterpillar. Plays our music. Wait for it. Caterpillar. 1 for no, 2 for yes. No for him too. Okay, it's a super subtle no. You just gotta be paying attention. The other thing I'll tell you is that these are all things that I had hooked up to a switch and turned on for him in the previous sessions. So we have a list of like 5 things that he sort of thinks is cool. We're gonna have to do something, Joseph. You can't just run the fan for 10 seconds and do nothing. Oh, something soft and loving. Look at you. Okay, his immediate response was a smile, right? It was a change. He was like, I'm not doing anything. Now he's doing something. I'm going to take it as a yes because it's different. It works. You're just going to like, if I'm wrong and it makes him mad, he'll cry and protest and I'll step back and start over. But first I'm going to say, nah, you're telling me this is what you want. All right, that's Sydney sing along. Oh, is that a yes? You want to see Sydney? I'm excited for her. I know. Look at you. 1 for no or 2 for yes on Sydney. I think you need to sit up and swallow, hot hot. That's what I think. Okay. Better? Yeah. Okay. Did you see those flutters? I said better, right? He's sitting back there on his spit, and his immediate response is yes. Now, I can say, hey, that's just a reflex. Or I can say, I'm offering you this once again. Prove me wrong. Prove me wrong that this doesn't mean anything. I'm going to take it and I'm going to shape it because that's how it works. We're going to shape what you're doing with what you can do already. Yeah. Are we going to play Sydney? Oh, we are playing Sydney. Cool beans. Okay. I'm going to set him in your lap. Remember, Sydney's a lot of bang for your buck. You only have to turn him on and then he goes for, oh, I know, really long time. A really long time that old Sydney does. Okay. Wait, where we? He's on star. He's off. Make sure all the adults do all their parts. Just real quick. He's ready. He's ready to read to Joseph. All right, Joseph, are you ready? He's not. Is he plugged in? He is. Okay. He's plugged in and on. We've done all the right things. Okay. Okay, so really quickly, it's a wobble switch. It doesn't require lots of movement. And I've already established, we messed around with where this works and he doesn't have to do much. So I'm doing a lot but he's going to do something. So you just got to watch close because it's not a far movement. But I'm working with what I have. All right. You ready? You go to Sydney. Turn it on. Just hit the switch right there. Just a little further forward. There you go. Okay, see him? Okay, he volitionally moved himself forward. And that's all we're looking for. We're just now going to build this lovely cause and effect thought process, right? We're going to move through it. And that's the starting point. Not every kid can do that. I totally get it. So I'm going to give you a few things as I'm going to run out of time. So sorry. Okay. So after we know where they're at, now we're going to lay down these things with some cause and effect activities. The more motoric, auditory, reflexive, and visual difficulties your child has, the more difficult this does become, but it's not impossible. Okay, this is a program. It's called Every Move Counts. Once again, it's another one of these programs. It has an assessment with it. I feel like there's the communication and matrix assessment says this is what level your child's at. Now this is like, what does my child love and how do I shape this behavior? Okay, this program has both a parent manual and a professional manual per se. And let me see real quick. I will show it to you. This is the book. It goes through a wide variety of vestibular activities, olfactory activities, movement activities, all these variety of activities, and it talks about how you actually systematically decide if a child does or doesn't like something through just what do they do, and then how to apply a symbol to that. I think it's a great place to start if you're trying to figure out where to go next. Okay, this is what I use systematically when I'm making some decisions. Okay. First thing we have to do is we have to spend some time finding some things they love. Remember, their currency, not ours. So we also want to do something, look at some things if they are moving, but they're a kid who loves to rock. How can we shape that, right? If they're just personally rocking themselves, can they sit in a rocker? Can they sit on a ball? What can they do? We want to consider a wide variety of sensory-based activities. Smell, touch, sight, vision, vestibular, taste if they're able to eat, and auditory, right? These are these areas that I look at. What does your child love? What can I do? If they're a kid that is just totally not capable of moving, and Joseph was one of those kids, right? When he's by himself, he's just kind of sitting there. How do they brighten with what we give them? So do you love music? Do you love rocking with me? Do you love swinging? Do you love when we put a fan on? What can we do to help you have a better quality of life? And then how do I shape that so you can get what I want, what you want? Okay. Activities for pre-intentional behaviors. We're going to develop routines. Routines are highly important. Why? They develop consistency. We're going to do the same thing the same way every time. They don't need you to change it. They need to know what to anticipate. When you learn to anticipate, then you can learn to make some requesting. We're going to move you into that next level. All right, so we're going to offer that as a symbol to the kid. All right, so here's some symbols. They're in my PowerPoint, and I'm hoping y'all got them in case we can't get all the way through. But let's say just changing a diaper, right? So here are some different symbols. Let's say your kid doesn't have vision. Use a baggie and put the wet wipe inside the baggie and whack that in front of their nose every time you're going to change that, right? I'm telling you, this is what I'm doing. I'm helping you anticipate what's next. I'm going to tell you what I'm doing with your body, right? I told Joseph when I was going to sit him up. Why? One, if he does understand, he darn sure doesn't want me moving him through space and place without acknowledging that he should be no. It helps his body get ready. And two, if he doesn't understand, maybe he'll start to. So we should help them with that. They could touch and feel the diaper. If you have a baby doll, you could get a doll diaper and put that on a schedule system and have them touch that. A jig is what I showed you a while ago. I don't know if you can see my face. With the picture that was cut out exactly like that item. You could use just a square picture of a diaper or a toilet or the written word. And so that kind of gives you that symbol system all the way through from I can't to I am actually picture exchanging. And so how do we do this? We present the symbol along with the verbal cue that lets us know. Then we consistently change the diaper the same way each time, giving a verbal step, not a paragraph, couple of words. I'm going to pull down your pants. I'm going to open the diaper. I'm taking it off, right? The goal is to help them anticipate what's coming next. Foot bath routine, the same way. I had it all set up with a switch, but really what I'd like to do is very quickly show you my ball routine because I think this is an easy way to show you. And I brought my daughter's baby doll along, and hopefully I can get it all on camera for you. Let me see.
And Amanda, we can go a few minutes over too, so don't feel like we have to do a hard stop.
Okay. Okay, what happened to my camera here? Oh. Okay. All right. Every touch it. Okay. So, I love the ball routine. I have just a peanut ball. Okay. And let me see. I will fix that. Okay, good. All right. This is me. This is my child who has lots of motor needs, and I am sitting on the ball. Okay. And I have put them in my lap and I'm holding them. And now I am going to bounce. But before I bounce, I'm going to take my ball symbol and I'm going to say, we're bouncing on the ball. Okay. And then I'm going to go and I'm going to sing this little cheesy song because once again, I'm going to develop a routine and I want you to know. So here we go. We're bouncing on the ball. We're bouncing on the ball. Hi ho the dairy-o. We're bouncing on the ball. Stop. Why do I say stop? So they know that's what stop means. And this is my kid. And what does my kid do? My kid goes like this. He pushes on me and he pushes me back. It's called coactive movement. Or he starts to cry. Okay. If I've stopped and you start to cry, that means, hey, bounce me again. If I'm trying to move my body against you, you're telling me that is not how I want you to tell me. So, but I'm going to acknowledge that you've done this. Oh, you want to bounce? Great. Tell me, ball. And I've got it here and you're holding it in my hand. Great job. Ball. And now we do this again. Bouncing on the ball. Okay. Don't have a symbol. Or they're ahead of that. Here's a jig. Looks just like my peanut ball I'm sitting on, right? I can do the same thing with the little Velcro board. Peel it off, put it in your hand. This isn't how we want to do it. We don't have those things. Not a problem. This is the sign for ball. Shape it, ball, bounce. Or sometimes I just have the kid tell me bounce with their hand. Bounce. Is that the real sign for bounce? No, doesn't matter. Me and him know what it means. And we go bouncing on the ball. We're bouncing on the ball. Hi ho the dairy-o. We're bouncing on that. The kid starts to cry. He wants off my lap. I'm like, oh, you're all done? Great. Tell me. Stop. All done. Now you can get down. We didn't get down by getting over me. We got down because I stopped. I'm like, you're okay. Tell me. All done. It's the repeat of this over and over and over again, even for the kid who is pre-intentional, who has no idea that he's affecting me. This is how I get him to know he can affect me. This is how, by shaping what we were doing before. I just happen to know you like this. You have those kids who are like, don't know that I like that. Everything we do for them new is a cry. Okay, here's the thing about that. You don't know what you love. It's not a protest against, and I'm gonna sit back on my chair. It's not a protest against, I hate the swing. if you sit down and every time you put a kid on something that's vestibular, they freak out, you don't know that you hate it. So I'm a firm believer in you should try it first. You don't know that you don't like it. I have hundreds of kids who have come, not hundreds, but a large number, who've come and hated something because it's new. It's a little scary. That's okay. How am I ever going to know if you love something if I don't say, try it anyway? Just a minute, you're going to be okay. I'm a safe person. We help them to understand that by moving through those moments, right? So I know I'm not everybody's fan, that's for sure. However, I'm okay if you cry. You're going to cry a lot when you're with me, but not because you're not having fun, but because we have to work this out. And this is hard. So if every time you cry, you get out of something, guess what you're going to have? A very limited amount of things that you're willing to do, and then we can't do stuff together. So my rule of thumb is usually with me is better. I'm way lots of fun. And you have to have some ability to keep moving. So we're going to probably get on the swing every day until, one, when you get to the swing, instead of falling out, you indicate to me in a way that we've determined that that's not what you want, or you learn to like it. And then we'll do something fun with that too. Okay. Here are just some pictures of some symbols. There's one for brushing teeth. Oh, sorry. I don't even know how to do that now. Well, I apologize about that. I hit that note too fast. There's some for brushing teeth. There's some for the ball. Just kind of depends on how you want to do that. But symbols are great. There are tactile ones for just feeling. If you have a visually impaired child, that's most likely how they're going to have to learn it anyway. It doesn't mean they can't have a more sophisticated system later through auditory scanning, but this is where we start. And we're not talking about sophisticated systems today. In addition to choice board making, we want to have a schedule system that is what their day events are. Okay, why? Not because we want to be hard and fast to a schedule, but because we want you to learn to anticipate so we can build those communication routines. And after we build the routines, we're going to change the schedule up, but you're going to know what's coming next because we've put a symbol with it. Here is a symbol hierarchy. It's the real object. If you're visually impaired, it could be a tactile, smell, or auditory representation of that item. So like you could always just play a little small clip of a song if that was like what you signed up for music time. If they always eat the same applesauce every day, or you're going to do a tube feed. There's nothing wrong with their olfactory system. Pair it with something. If you don't want to pair it with the milk because you don't like the smell, just pair it with a smell. It's okay. Or with the tube that you're going to use just to give them that anticipation piece. A smaller object, but not the real item. So that would be like my bed. A jig is those cutouts like I was showing you with the ball. It looks just like the ball, but it's just a 2D picture. The real photograph of the item, not cut out around, so not a jig. And then color drawings, black and white line drawings, and then your written word. Okay, we've talked a lot about unconventional communication shaping, but here's just kind of my rules of thumb, and then I'll stop here for today. We're starting with protesting and requesting of preferred items. So figure out what your child's currency is. You have to be a giver of these things. If your child gets everything themselves, or if you're always just doing for them, there's no way to build the communication. It has to be two-way. So what do you want? How can I help you? And even if you don't think they can, and Joseph is a great picture of you can. We just have to figure that out. And that's complex, no doubt about it. But we're going to start with things we know you like, try to build something. No is an important word. Boundaries are important. Your child's going to cry. They're going to be upset. They're learning something new. That's okay. And here you want to shape these behaviors using the above hierarchies of that symbol system. That's how you're going to work through them. These things I've already kind of touched on. every day as much as possible. It can't just be in therapy. If you don't use their system, they won't use their system. You have to use it to communicate with them. And it's a team approach. I can't help your child without all the team. Teresa was always great. When I was building a communication system and she was building a motor system, we built the system together and with the parents' input. But if Joseph isn't positioned right, it won't matter. We'll never see that. So those things are so important to me being able to do my job. And then last but not least, this is my contact information, and I guess that's really hard to see. I didn't know that.
We'll include it. We'll make it clear for people to see when we put it up.
So that's my PowerPoint.
Let's see. All
Well,
right.
Thank you so much, Amanda. That was really great. I'm looking to see if there's any questions. I actually had a question, which is when you were talking about bouncing a child on the ball. I know as parents, we have to be really patient, and sometimes our kids hit plateaus, and and you feel like they're never gonna, make get to the next level. But how many trials do you find that often, like on average, or just for parents who are like really struggling with this, like how many trials does it take to shape a new behavior so that parents don't get really frustrated when they're doing it for the 50th or 100th time? Can you just sort of touch on that a little bit? Because I know that's something that we all, get frustrated with.
Every child in their own. And so I wish I could say, oh, it's like this. One, I think you have to start with, so Joseph's a great example, I think, of when the conditions are right, it can be amazing how quickly it can happen. Because there's just a few sessions. We just happen to hit all the right things in the right way. But if you think your child is loving it, then it's about quality of life, right? So we're doing an activities about quality of life. So just enjoy the moment. Because sometimes it's like the 109th trial, and sometimes it's like the 1000th trial. And the truth is, there's a group that won't. But if you think they love it, they're not fussing, they seem to brighten, then it's really kind of about that piece, right? Of just be present in this moment, because this is the moment that we have. And so I'm always torn between, are we working toward a little bit of quality of life, or are we working toward that next communication piece? But what if you did it 1,000 times and on the 1,001st try, he reached up and touched it and stopped, and it was the one. So I say do it anyway. Those moments, those are supposed to be special moments. We spend a lot of time with motorically involved children, moving them over here, doing the next thing to them, and there's not a whole lot of regard for, I don't mean this in the wrong way, but in general, most people stick with the communication because it's two-way, right? I got something out of this. For these guys that are motorically involved, sometimes they just can't give it back. So we're looking for I shared the moment. The moment was great. If you're bouncing on the ball and the child just sort of moves and it's like the first time, I would do a hat dance. Absolutely, you just told me, yes, we're gonna bounce like 2 times, not 1 time. Because what if that's what it took? So I always say, and I've had parents come in and say, well, I mean, I thought that they said this before, or I thought they did, but they never did it again. I say, yes, I said they did. If it was something different the one time, do that again. And just say, yep, today was the day they reached out and touched ball, even if it was accidentally, even if they just pushed back 1 time. Because that's what makes it happen. And why not? Why not? What makes us say, nah, it couldn't have been? Yes, it could have been. Let's go with it.
Yeah, I think that's so fantastic. I think, and I love your point about just presuming capacity, presuming ability, presuming communication, and then running with it and using that to build on. And I think, I did also just say, I just feel as a parent of a kid who's really medically complex and a lot like Joseph in your video, you see our kids you understand our kids and you get it. And that's so powerful, because I think a lot of us never find the therapists like you who are willing to put in the effort to understand our kids. And so you're an incredible resource. And I think that for a lot of people who don't have access to incredible therapists like you, how do you, what's your advice for us to do this at home? Obviously, we're not going to get our hands on an AEC very easily if we don't have good therapists, but we're talking about low tech today anyway. So
the rest is fairly easy. There's lots of switch adapted things. And you don't have to start with switch adapted stuff. You can start with, okay, first of all, every switch adapted toy is marked up 1000% because they stuck a plug in. However, Sing Along Sydney exists with no switch. So how do you swap that, right? If it's just about finding the preferences. Finding the preferences are, hey, here's this new toy. Let's see what you do. And Joseph can't reach on his own, right? So I'm like, hey, fill this up. This is the thing. So it's kind of that, right? If my little unicorn here sang, I'd be like, hey, look, I got you a new toy. And look, let's feel it. This is Unicorn. This is what we're calling him. Unicorn is right here. And look, here's his on button. And I'm gonna let you turn him on. And he sings, he does his little thing, and he gets off. And I'm like, now look, here's Unicorn. Let's do that again. If he starts to, okay, no Unicorn, that's fine. Let's find something else. I mean, that's how we played this game. We didn't just hook him up to a switch and say, hey, let's do this. No, the first 2-3 sessions that I put Joseph in that situation, I said, okay, so let's just see if we have cause and effect, right? So took his head and I'm like, look, watch, boom, this is on. This is how this happens. Because it's not like you set him up and you be like, okay, hit the switch. And I'm also a firm believer in hit the switch, touch your, push a button. No, that is wrong. That is not what we're doing. We're turning on Sing Along Sydney. That's how you turn on Sing Along Sydney. I turn on Sing Along Sydney on her tummy. You don't. So what do I want you to do? I want you to turn her on, not hit a switch. We're not hitting switches. We're doing something. So we want to be really purposeful about what we're saying. Even when we have a talker, it's not push a button. Tell me go. You tell me, this is how you tell me. I say the word go, you say it like this. So we want to be systematic and purposeful with what we're saying. But when we start, I mean, I know that sounds awful, but I'm like, this is on, boom. And I might say, hey, I'm gonna show you, right? If it's not here, and I can't seem to get this to work out, and obviously it's super minute movements, right? I'll be like, that's okay, let's find another space. I have other switches and different things that I do, but before I assume that it's a no-go, I'll pretty much see if I can find a big toe first. Like, we're gonna do something if I know you like music, so you have some way to do that. I was gonna show you guys really quickly, like, so this is like a foot bath. It's a great routine. I have it hooked up to an Ethernet switch over here. And that same deal, but I'll show you, which is a power link, and it allows you to like turn something on for so long. Okay, but guess what? So doesn't matter, because you can put your kid in a foot bath with some bubbles and soap, and you can say, and I usually pair that with either the smell of the soap if you're visually impaired, right? So I just use the same soap every time. Or here's the terry cloth. We're gonna take a little bath in the deal. I'm gonna put your feet in here with some warm water, and we're gonna like have spa day. And I'm gonna turn it on for like, I'll just time it on my phone, 10 minutes. All right, so we'll like get a little cue of, hey, feel this, here it is. I might even have your hand propped. I'm just looking for you to like touch it like this. I'm only running it for 3 minutes, and then I just cut it off myself. Now, do you want some more? I'm waiting for you to push your hand down to show me that you want more. So it doesn't have to be much, and it doesn't have to be sophisticated. We're just finding activities you love, and then we're going to shape it. And then enabling devices, AbleNet, all those people have a wide variety of different switches. Sometimes your early childhood intervention centers have them, AAC system centers, where you can just play with the stuff and then adapt your home. Christmas lights and a timer, phenomenal. So you don't have to be sophisticated, and you don't have to run out and buy the next switch adapted toy. Take your other children's toys, or go down to Goodwill and buy the sensory light spinny toys and just play with them. Help them put the gears on. See if you can get them to reach out toward it. Use those as your indicators.
Yeah, I think that's such great advice too, because they do mark up everything 1000%. So knowing that there's other ways to get the cause and effect. And I do thrift stores all the time. That's the way to do it. Because if it doesn't work, it's only $3 and then you get it back.
And my thing is, if they love it, right? If they love it, then invest the money. But so my other thing is, I always tell parents, okay, how many of you have a hard time picking a Christmas gift for that child, but you have a willing and loving grandparent or an aunt or the godparent or whatever it is? You actually have someone who would. Okay, we know he loves the gears. We would like this $60 toy. That's what we would like.
Right.
For Christmas. Like, this would be his thing.
Yeah, no, that's terrific. And Erica reminds us that there are YouTube videos on how to adapt your own switch toys, how to make your own, which is definitely doable.
Yes, it is. And it's really not hard. You can make your own switches out of foil tape, the old CD cases, and some wire. Now, I'm not that person, but Teresa Spong can help you with that, because she used to do that.
Teresa, we'll be calling you. Yeah.
But yes, you can do a lot of this inexpensively.
Yeah.
So
And
it's like 1,000 times, and the 1,001 is going to work. But
yeah, no, it takes persistence and patience on everybody's part to make this work. And Sherry was mentioning how the reminder to just make routines and to build it into our days is so important. And like in my family, we've done that, like with toothbrushing. He holds the toothbrush, we feel it, we talk about how it feels, we shine a light on it so we can see it. And then we have a symbol, this is brushing teeth. So he gets something that it's input, and building that routine. And that's hard to do for everything, but
for some things, it's helpful, and it also reminds them. Okay, so I have found that motorically evolved children normally have two choices: check in or check out. Okay, I can't make you check in if you're checked out. All I can do is pray that I find the next right thing, because when a motorically involved children chooses this as their option, we've all lost. That's when they've decided that nobody's paying attention and they don't care. And I don't mean that ugly, but by and large, if we're constantly seeing that, oh, we had this moment when they could, and now there's these moments when they're not. Okay, the checkout option for them, I don't have to participate, and you can't make me. So we got to have enough fun stuff to keep you checked in and help you to realize that we're more fun together. So I find that those are my most difficult situations, when I have a kid who I have determined can, but they've decided they'd rather be checked out. And I don't really want them to be checked out. I like them to be checked in.
I think that's also the Every Move Counts program is very sensory based, right? So it's keying into all of that. Yeah.
Well, I don't see any. Eric also says Amazon sells the battery interrupter for adapted toys, which is another great too. Maybe we'll remember to link to those so that families can see what those are. And if you have other things, Amanda, too, you want us to include, we'll include a link to the communication matrix and all those kinds of things. But this has been amazing. It's been incredible and emotional for me, who's had, I have a 9.5-year-old who's never really had great therapists, and so a speech therapist. So it feels validating, and you're doing an amazing job, and we're so lucky to have had you today. And for those who don't know, Amanda's joining us next month to talk a little bit more about the AAC and the kind of more high tech ways of engaging with our kids. So thank you everyone for joining us. We'll be putting all of this up on the website, and CACNA1A will have it on their website as well. And, we'll be sending out a survey, so please let us know how we did, and we look forward to seeing you next time. Thanks so much, Amanda.
Thank you,
Thank y'all
everyone.
very much. I enjoyed it.